This is a brief overview of the recommendations on cervical cancer and prevention. This policy brief was developed in the CBIG-SCREEN project. The scientific coordinator and project lead is Professor Marc Bardou of INSERM, France. CBIG-SCREEN has received funding from the EU Horizon 2020 Research and Innovation Programme under Grant Agreement No. 964,049. CBIG-SCREEN is a project which aims to tackle inequalities and inequity in cervical cancer screening by developing a Europe-wide knowledge framework around barriers to cervical cancer screening. Its missions are the following: assess current cervical cancer screening status among vulnerable women, including existing policies, stakeholder landscape, barriers, and preferences for cervical cancer screening among subgroup of vulnerable women. Develop tailored intervention models that increase cervical cancer screening in subgroups of vulnerable women. Assess implementability and demonstrate scalability of intervention packages. Assess health benefits and cost-effectiveness of intervention packages. Disseminate findings and deliver recommendations to EU representatives and policymakers, so they will translate into profound and long-lasting benefits for vulnerable women. Cervical cancer. In 2022, across the EU 27 states 28,211 individuals were diagnosed with cervical cancer. 13,636 individuals died from this disease. Cervical cancer is mainly caused by human papillomavirus, HPV. It commonly affects women and individuals with a cervix aged 30 to 50. HPV vaccination and regular cervical cancer screening are proven ways to lower the risk of getting cervical cancer and to reduce the number of deaths because of it. In 2022, across the EU 27 countries, cervical cancer screening reached about 72% of women. However, screening can be high in some countries, 79% in Sweden, and very low in others, 4.5% in Romania. Some groups and communities are underserved and have lower screening rates. This can increase the risk of developing cervical cancer if it is not detected early and treated accordingly. Many countries recognize lower screening rates among these groups, but only few have policies to counteract it. Cervical cancer is one of the few cancers that can be eliminated as a public health problem. This is a goal supported by the World Health Organization. To eliminate cervical cancer, the target is to have fewer than 4 cases per 100,000 women and individuals with a cervix. The WHO promotes the 90-70-90 strategy to reach this goal. 90% of girls, and people with a cervix in general, should receive HPV vaccination. 70% should be screened for cervical cancer. 90% of those with cervical cancer should receive treatment. To reach the WHO goal, equity in cervical cancer prevention is needed. However, some groups and communities are underserved. Underserved means that some groups experience barriers to healthcare, lack of information, accessibility challenges, cultural insensitivities, and lack of inclusion in policies and guidelines. Barriers or risks are not necessarily medical, but relate to other issues affecting a person's life. The social determinants of health are non-medical factors that affect a person's health. These include things like housing, education, access to healthcare, neighborhood conditions, other social and environmental factors. People from underserved groups often face challenges in getting quality healthcare. They may deal with economic hardship, physical limitations, social exclusion, emotional stress. These difficulties often arise because policies, systems, and research do not take their specific needs into account. That is why these groups are often described as being in a vulnerable position. Barriers to screening and changing existing screening systems can be lack of inclusive spaces, limited policies that focus in these underserved groups, scattered follow-up systems and healthcare infrastructure, cost and accessibility problems of the screening program. Lack of awareness and information on cervical cancer. Different healthcare systems in every country make it difficult to have a homogeneous system. Overcoming challenges. Several recommendations can be made to overcome barriers and increase participation in cervical cancer screening, offering mobile clinics and different methods of screening, for example, self-sampling, Have education on cervical cancer, its prevention and treatment for the public. Train healthcare providers in cultural competence and inclusivity. Create inclusive and flexible structures that increase access to healthcare. Ensure financial support mechanisms. Ensure communication and engagement with all groups and stakeholders. Collaborate with stakeholders and communities to advocate for improved access to healthcare and cervical cancer screening. To continuously monitor effectiveness of programs, data have to be collected and analyzed. Data on screening participation rate, follow-up and detection rate, vaccination coverage, satisfaction and trust of people engaging with the screening program. Vulnerable positions but also needs and wishes can change. This means that these have to be analyzed repeatedly. Ways to do this can be collaborative user boards, engaging with stakeholders and diverse groups, regular interviews and consultations. The policy recommendations derived from the CBIG-SCREEN project are the following. Expand access to HPV vaccination across all socioeconomic groups. Implement regular screening programs using pap tests and primary HPV testing, with self-sampling options. Ensure equitable access by providing tailored programs for groups in vulnerable positions. Integrate digital tools for tracking, follow-up, and patient reminders to boost participation rates. Co-adapt programs based on local cultural contexts and lived experiences. Pay attention to contextual and cultural factors that influence access and participation. Engage stakeholders on all levels as local champions. Use collaborative user boards format to tailor and sustain effort. For more information and to download the full policy brief, visit our website www.cbig-screen.eu and follow us on our socials.